Hello everyone, this is Dr. Nasser, and in this clip we are going to continue looking at normal white blood cells. The white blood cell that you have in the field is an eosinophil. And you can notice the nucleus. In this case, the nucleus is segmented, but most of the time the nucleus of eosinophils may be bilobed. However, the distinct characteristic of eosinophils is their granulations. The size of granules is very large. There are a few primary large dark granules, but the majority of these granules, the secondary granules that you can see here, not only they are larger, but their color is eosinophilic, which means is something between orange and red. And that is the distinct characteristic of eosinophils. They are involved in various immune functions, usually involved in inflammatory responses, as well as in parasitic infection, allergic reactions. Eosinophils becomes very active. So again, note the size of the granules. Yes, indeed, there are some black granules, primary granules. However, majority of the secondary granules are smaller in size and orangish in color. And that is the distinct characteristic of eosinophil. I would attempt to find some other white blood cells in order to compare these cytoplasmic granules in the cytoplasm of eosinophils to other cells to show you how distinct these granules are. What we have in here is a resting lymphocyte. And I would like to show you quickly, by increasing the light, the pattern of the nucleus of a lymphocyte. You can see there are lighter and darker areas. There is a scant amount of cytoplasm, slightly basophilic in color. This is a resting lymphocyte, and in this case, you can see the size of the nucleus of this lymphocyte is pretty much the same size as the normal red blood cells. And therefore, what we have here is normocytic, normochromic red blood cells. And that is a resting lymphocyte. Monocyte in here, you can see the size of the monocyte is much larger. The cytoplasm does not have the granules that we saw in eosinophil or neutrophils. However, you can see there are some granules are present. However, these granules do not stain as much, so they appear to be, the cell cytoplasm appear to be a granular. You can see there are some pseudopods. Monocytes, remember, they are phagocytic cells. The nucleus in this case appear to be kidney bean shape, and these are just general characteristics. The grayish, bluish cytoplasm and large size and horseshoe shape nucleus are characteristics of monocytes. You do see another monocyte in this case. You can see the size. This monocyte is very actively phagocytosing, and you can see the presence of the phagosomes in here. You can see the shape and appearance of the cytoplasm is quite unique. The nucleus is kidney bean shaped, but you have to use your imagination a bit. It's a horseshoe, but the ends are very close together, and you cannot see the appearance of horseshoe, but they appear to be horseshoe or kidney bean shape in overall appearance. This is a monocyte that is actively phagocytosing some elements in the blood. This is an artifact. Is nothing that need to be reported. Here we have a band neutrophil. Now you can see the cytoplasm of the neutrophil is quite different than monocytes and different from the eosinophils. The nucleus is continuous without any specific segmentation, and that indicates this is a band, slightly immature neutrophil. And the cytoplasm has various type of granules, different sizes, but much smaller than what you observed in eosinophils. There is a platelet on this side and appear to be normal looking platelet. We do have another band neutrophil. So it seems that the band neutrophil in the slides are elevated, and that indicates a mild lift shift, which means for whatever the reason is, likely due to an infection, the bone marrow releases younger white blood cells, in this case neutrophils, into the circulation, and that is why we do see an increased number of the bands. Usually about 1 to 3% of the white blood cells should be band neutrophils. That is a resting lymphocyte, and partially we can see a segmented neutrophil. And you can observe that there is quite distinction between the shape, the size of the nucleus, the cytoplasmic granules. Basically, there's a very scant, this is blebbing of the cytoplasm. Sometimes you can observe that as an artifact. Sometimes they are indicative of various conditions. In the neutrophil, you can see the cell is larger. There are primary granules present. And again, these neutrophils in here indicate the presence of toxic granulation, which you quite often may observe in the case of infections. And with the appearance of the monocytes in this slide, as well as the appearance of the toxic granulations, I do suspect that this patient is dealing with some sort of infection. The other cell that I am trying to find for you is basophil. And basophil are not as often seen in a blood smear as other white blood cells. Usually 1 to 2% of the cells are going to be basophils. Basophils are often seen in allergic reactions. They have granules that are going to be large and dark, basically black color granules. And they are seen in, and inside those granules we have histamine and heparin. And you can see the size of the granules that are present in this basophil. So the nucleus is difficult to discern, however it looks like a segmented nucleus, but it's difficult to identify exactly what the shape of the nucleus is. However, you can see the size and the color of the granules that are commonly seen in basophils. There are many cells, basophils, that you may be able to see in which the granules are so abundant that you cannot see the nucleus at all. And on the other side of the spectrum, you can see basophils that during the process of fixation and slight preparation, some of these granules are going to wash out, and the basophil is going to be without many granules. Occasionally you can see a large dark granule in the corner of the cell. However, the appearance is quite distinct. So this is a basophil with large, dark, and black granules that are very unique to the basophils, and you don't see that in any other cell to this extent. Another cell that may have this appearance is the mast cell, but mast cells are usually found in the tissue rather than in the circulation.